The term immediate load, that actually has different meanings to different doctors in different situations. We may talk about a front tooth implant where we're putting an implant in and putting a temporary on it that day. Generally, you're not going to put pressure on that implant right after it's gone in. So even though we use the term immediate load, maybe a more proper term ought to be immediate provisionalization. Provisionalization simply meaning a provisional restoration, which is a temporary restoration, taken out of the patient's bite. Then we have cases that are what we term full arch cases. Full arch cases are ones where you might have heard the term teeth in a day or teeth express or something like that. And basically those cases are ones where multiple implants are put in a full arch situation. So somebody's going to have to lose all of their teeth in those cases. In those cases, we can put pressure on the implants right away because all of the implants, through the prosthetics that connect to them, splint them all together. So both of them are oftentimes called immediate load cases, but there is actually a difference. One of them you do put pressure on because of the splinting action of them, and the other you're simply getting a prosthetic that's out of a patient's bite. Key to being a candidate for immediate load, again, depends on the case, but if you have a front tooth, you have to have adequate bone to be able to place an implant into when you take the tooth out. If you're talking about a full arch case, those cases actually patients have a lot more ability to do that because oftentimes we can use bone that's even beyond the ends of the roots of the teeth to still stabilize the implants at that time. So oftentimes we can do an immediate load type case without doing a whole lot of bone grafting or anything like that. The ability to have immediate load is very important for patients oftentimes because again, they walk in with teeth and they walk out with teeth. They walk out with something that's very stable in their mouth. They're not having to wear something removable in their mouth. And quite honestly, a removable type appliance sometimes can actually be more damaging to the implants. In our practice, we run at about a 99% success rate with our implants. However, the failures that we generally have are the patients who have to wear a removable appliance over their implants. That removable appliance puts pressure on the implants before the bone has had time to bond to them, and that causes failure. So when we can go with an immediate load type case, we're going to have stabilization of the implants oftentimes in those cases.